about pubic bone pain this morning. The pubic bone, pubic symphysis pain, that's that front of the pelvis where those two bones come together. Usually people have discomfort with that with single leg weight bearing, asymmetric weight bearing, so walking, going up and down stairs, lunges, running, that kind of thing. The context in which I want to chat about it is I had two clients this week, both of them telehealth. I love it when somebody's like, I have this. I'm like, I can fix that pretty easily. It's easy to diagnose. It's easy to sort of figure out where to start and then where to progress. So the two were very, very different situations. One was postpartum, post C-section. And honestly, I think we could have staved this one off because she had it in pregnancy. We did do this session about 6 months postpartum. I think had we done what we did earlier, we probably could have staved it off. But basically, a lot of it is just going back and understanding that you need deep abs to stabilize around that pubic bone. And so the way that we will tease it out or diagnose it, so to speak, is if you squeeze something between both knees and it's uncomfortable, or if you spread both legs apart and it's uncomfortable, so that that machine, that abductor, adductor machine that squeezes in and out, that's a great one for diagnostics. Sometimes we'll also test those same movements of the leg in and then out, just on one side versus the other. And what I'm looking for is, do they hold their breath? Do they, how are they stabilizing? Does the whole body move? And usually if that's painful, what we'll do is just add an exhalation breath strategy or a drawing in maneuver where we're trying to get TA activated. And I'm making a guess over telehealth that, and I would say it's probably like 2/3 of people, when they do that and the belly's not pushing out, we're going to get some sort of TA. Obviously here in the office, I have real-time ultrasound imaging. We can actually make sure that what that strategy is that I'm giving them to do is what it is. So when they do that before and during the squeezing together or the pulling apart, if that magically makes your symptoms better, guess what? That's where we're going to start and then build up from there. So the first person I was thinking about, she just emailed me yesterday and she's like, yeah, first time in like a really long time that I can deadlift now and feel good. And she's very, very, very strong. And she's like, I haven't had any pain. This is great. I'm like, great, boom, done. And then the other one is someone training for a marathon that's coming up in a very short period of time, not doing any strength training, in more of the perimenopausal phase. And I'm like, well, first of all, I'm sorry, because us peri-moms, we didn't get all this education. We weren't taught that we need to do, number one, strengthening to run, and number two, to get coordination going, and to kind of build strength on top of that. So in some ways it's like, okay, that's not your fault. So from there, I was just like, hey, same thing. We tested it through. Everything looked good. It came across that she was positive for those things, and now she's starting to build on this, and we're going to try and build this strength up before her marathon and see how far we get. So short answer is it's symphysis pubis issues or pubic bone dysfunction. It's pretty easy, honestly, just from symptoms to figure out what that diagnosis is, to test it and to see if that strategy is going to make symptoms better. That's pretty easy. And then it's a pretty straightforward progression back up depending on what you're trying to do. So if you have questions about symphysis pubis issues, shoot me a message or DM. Happy to chat about it more. If you're a clinician and you're not screening this out, and you're worried about, how to do this, again, hop on my DMs. Happy to help.